All right, welcome. So today we are going to be talking about the older adult, and I love this picture of this slide. Albert Einstein said, "Learn from yesterday, live for today, hope for tomorrow. The important thing is not to stop questioning." And I think as a nursing student that is so very true. So focusing on the older adult, we'll be looking at clients older than 65 years of age. And we also recognize that with the older adult, the developmental task identified by Erickson is ego integrity versus despair, representing the ego that their life had meaning versus feelings of worthlessness. And as you care and interact with the older adult, of course, it's important to keep that stage in mind to see if they have met that or not. There are theories on aging. The programmed aging theory is a result of changes following a timetable. AIR looks at aging as related to cellular damage from stressors. Overlapping theories identifies that many different theories are interrelated and overlap. And in your textbook, see Table 27.1, page 873 in your Demacchio book. Overall, looking at these, we recognize that one theory is not universally accepted, it's just being aware of them. So this is the biologic theories of aging. Biologic theories focus on aging as it relates to the cells, tissues, and organs, and what occurs during the aging process. The programmed theories focus on those programmed theories are looking at physiologic mechanisms versus the AIR theories are looking more at random cellular damage. Aging as a natural process does occur over the lifespan of all organisms. Senescence is the term used to distinguish changes. It's the process of aging. You see this process as graying of hair, wrinkling of the skin, and the changes that have no impact or on viability from those changes that create risks for disease, disability, and death. It is defined as deterioration of organ and bodily functions over time. Progressive loss of function increases the risk of mortality over time, and it varies from one individual to another. Loss of function in organs is an effect of aging. We're going to look at that in this slide, which is the impact of aging on organs and body symptoms. With the skin, there is lentigo cinereus, which is liver spots, and it's a melanocyte distribution. Wrinkles, there's a loss of elasticity and subcutaneous tissue. Baldness can occur in both men and women, and it has genetic factors. There is a decrease in sweat production due to diminished sweat glands. With the mouth, nose, and throat, smell and taste is diminished. The loss of teeth can occur due to poor dental care, diminished fluoride in water. With the eyes, you see presbyopia, which is nearsighted vision. Xanthosma are soft yellow plaques on the lids of the inner canthus. Pinguecula are yellow nodules on the conjunctiva due to sun exposure. Cataracts, clouding of the lens, changes light perception and clarity. With the ears, there can be presbycuous, which is hearing loss of high-pitched sounds. Accumulation of earwax that increased cerumen is very common. With the pulmonary respiratory system, the pulmonary tissues stiffen, breathing becomes harder, and gas exchange is diminished. Geriatric patients have a higher prevalence of using accessory muscles because of this. Cardiovascularly, there is a stiffening of the aorta, hypertension, a blood pressure above 140/90. Risk factors for this would be coronary artery disease, congestive heart failure, renal disease. GI changes. There is a higher prevalence of constipation due to decreased motility and weaker colon walls. Dependence on laxative use is often an issue. Diverticulae, hemorrhoids, and rectal prolapse can be related to straining and bowel distension. Looking at nutrition and fluid, calculating of the body mass index, you look at the height and the weight, and also you want to be aware of the waist to hip ratio, which can be a predictor of hypertension, and they are more likely to be dehydrated, so it's important to encourage fluids. With genitourinary, glomerular filtration decreases 75 to 80%. With glomerular filtration decreasing by 75 to 80 years, they have 50% loss of nephrons, decreasing their glomerular filtration. Sexual activities can be affected by medications. Erectile dysfunction, and with women there can be vaginal dryness due to tissue atrophy. Endocrine, often patients complain of fatigue. With musculoskeletal, there's a loss of muscle mass and joint wear and tear. Neurologically, there's a reduction in reaction time, learning, and short-term memory. This is caused by impulses that are slowed with aging. Going back to skin and looking at the loss of skin elasticity and subcutaneous tissue, I'd also like to identify that tenting is not an accurate assessment of dehydration in older adults due to altered skin elasticity. Nutritional risk factors on physical assessment and nutritional history in older adults. This table is showing you what you would assess looking at the face for sunken eyes, temporal wasting, note any changes, mouth, change in taste perception, lack of saliva production, teeth missing or loose, how do their dentures fit. Also monitor their chewing and swallowing mechanisms. Be aware of coughing with swallowing. It can be a sign of difficulty with swallowing, and also aspiration. Gastrointestinal, assessing for anorexia, nausea, vomiting, diarrhea, constipation, and heartburn, and genitourinary, assessing for darkened urine or low volume urine. With this, what you are looking for is dehydration. Again, monitoring for sunken eyes, that dark urine, and dry mucous membranes. Again, as we are looking at the assessment with these patients and their nutritional history, it's important to remember that tenting is not an accurate assessment of dehydration in older adults. With the skin, you also want to know the dry mucous membranes. Observe for any poor healing wounds, any pressure ulcers or rashes, loss of subcutaneous fat or muscle wasting, impaired vision, loss of hearing. Be aware that taste and smell losses are often related to medications and not aging, and also note any changes with the nervous system, specifically that impair the ability to prepare food, shopping, preparation, and self-feeding. And examples would be tremors, altered gait, confusion, neuropathies, and impaired cognition. If you are caring for a patient who has missing teeth, difficulty swallowing, decreased saliva, constipation, diminished mobility, dietary restrictions, then as a nurse you want to put them on a risk for nutritional deficiencies plan and place interventions to promote good nutrition and hydration. We're going to look at some vocabulary specific to the geriatric assessment. Xanthelasma are soft yellow plaques on the lids. They are associated with high cholesterol. Panicula are yellow nodules on the conjunctiva due to sun exposure. Pterygium is opacity of the conjunctiva that can grow over the cornea and block vision. Arcus cinereus, gray or white ring around the iris due to lipid deposits. It does not affect vision. Cataracts is lens clouding that can alter vision. It can be corrected. Presbyopia is nearsighted and treated with reading glasses or bifocals. Rhinophema is rosacea of the lower half of the nose. It's you see nodular swelling. Now we're going to look at specific areas of the older adult assessment. With the general survey, you're going to monitor vital signs and the nutritional status. With their skin, you will look at skin, hair, nails, and measure any lesions. Observe the head and neck, check for smelling ability, sense of taste, neck range of motion, palpate neck veins and carotid arteries. With the vision, you will check your visual acuity and visual fields. You'll ask about a history of glaucoma or vision problems. For ears, you will check hearing and also check for an increase in cerebrum. You'll auscultate the lung fields. With breasts, you'll ask about previous mammogram screening, a history of cancer or changes, or a history of cancer for them personally or in the family. Cardiovascular, listen to the apical pulse and auscultate heart sounds. Abdominally, listen to bowel sounds. Ask about a history of bowel movements and their laxative use at home. Genitourinary, ask about incontinence, urinary patterns. Men, ask them when their last prostate was checked. If they've had a rectal check for occult blood. Musculoskeletal, monitor and assess their joint movement, strength, balance, gait pattern. Neurologically, do a mini mental examination on them. Check cranial nerves. Assess for tremors or changes in their sleep pattern. In the next couple slides, we're going to review common problems in the older adult. We will discuss skin lesions, insulin resistance syndrome, diabetes mellitus, drug and alcohol abuse. And at this point, I am going to conclude this part of the lecture recorded, and we will start up on this slide. Thank you.